Healthcare practitioners use surrogate patients that differ in their abilities to exhibit symptoms, provide compelling interactions, and respond appropriately to touch. We present a generalizable method to detect and respond to multi-touch with low latency on a human head surface. We use rear-mounted infrared lights, cameras, and a color projector to detect touch events and render appropriate facial changes. A lookup table provides correspondences between the spaces: a 2D camera space for touch events, a 2D projector space for projector pixels, a 3D touch space point cloud from the cameras, and a 3D graphics space for projected imagery. Here is our prototype rig. It uses 2 infrared light sources, 4 infrared cameras, 1 projector, and the head surface. Using 123D Catch, we construct a high-fidelity 3D mesh of the head surface, forming the 3D graphics space. We calibrate the cameras and obtain their positions in the common coordinate space. We determine the correspondences between the 2D camera space and the 2D projector space. We build the 3D touch space by triangulating the projected circles. We register the point cloud with the dense mesh so that we can convert sparse 2D camera space points to dense 3D graphics points. Using Maya, we simplified the 3D mesh, modified and rigged it into an animatable mesh, and exported it into Unity. A virtual perspective camera at the same position as the physical projector renders the scene in reverse order from the back. The rendered image is then sent to the projector. Touch events appear as high-intensity regions. They are segmented and sent to the rendering system. There are 2 kinds of graphical changes: pixel level and vertex level. Pixel level changes affect the colors of the imagery. For example, we can light up the surface at the touch location. Vertex level changes modify the 3D vertices using blend shapes and bone animations that update as the point of touch varies. For instance, we can tug up and down on the lips and eyes of the model.
A 40-year-old female patient presents for a routine physical checkup. Hello, how are you doing today?
I'm good, thank you.
Are you having any pain?
No.
Do you have any complaints?
No.
I'm going to ask you to close your eyes, and then I'm going to do a quick assessment. Tell me when and where you feel this cotton swab.
Right cheek, chin, forehead, left cheek.
Okay. Go ahead and open your eyes. Can you smile for me? Very good. While you're smiling, I'm going to go ahead and examine your gums. I'm going to look at the upper lip and the lower lip. Very good. Now I'm going to take a look at your eyes. The sclera is nice and white. Now I'm going to look at the upper lids. Very good. Everything looks normal. A 40-year-old presents with neurologic symptoms to be evaluated for potential stroke. How are you feeling today?
Not so good.
Do you remember what happened?
No.
Are you having any pain?
Yes.
I'm going to do a quick neurologic assessment. I'm going to ask you to close your eyes and tell me when and where you feel the cotton swab.
Right cheek, forehead, chin.
You can't feel this one, huh? I'm going to take a look at your lips. You can leave your eyes open now. Go ahead and smile. There appears to be a droop. I'm going to look at your eyes. It appears you can't keep the left one open. We will have to do further diagnostic tests.